Welcome to Melbourne Sex Workers. Today I have James from Stigma Health. Welcome, James, to the podcast.
Thanks for having me, Eden. I'm very excited to be here.
Me too. I've been a big fan of yours, and it's a weird thing that I get really excited about sexual health and sexual education. I know that's a really strange thing, but I've been like super passionate about sexual education and sexual health since I was a teenager. I was involved in different youth groups within the gay and lesbian community, and yeah, I get really excited talking about it. So yeah.
So you've been excited for a couple of years because you still look very young.
Yes, I know. Yes, I do. I do look very young, but and yeah, I've already apologized to you, but my voice sounds funny today. I don't know what's happening, but it is what it is.
You know, your
But
podcast.
yes. Yeah, I would love to hear what's your background and how did you get the idea of Stigma Health and the way that you run things?
Yeah, it wasn't a straightforward path. It was so I was always passionate about business and I was passionate about business being altruistic, right? And a way of impact and giving back. I always thought that most success comes from helping more people. And that's where I wanted to be. And then So I became an accountant because I was passionate about business, wanted those skills to help me. Did tax accounting with ADHD, wasn't very good at it. I had more jobs than I did years in that industry. And then went on to going to hospitality, which was a great way to learn business, a very hard way to learn business, very tough. But I wanted to do something more scalable. So I was following startups and following the journey of like those out there raising capital and those doing those big scalable earth moving ventures. And I thought I could do that. And I thought, where would I want to do it? And healthcare really fitted my altruistic ambitions and, immediate impact. And plus, mum was a nurse, so and we're surrounded by healthcare professionals. I really wanted to get back to that. I resonated with the space, and we started looking. And I thought of an Uber for doctors would be the thing to be what we wanted to build originally, and that was 2015. Everyone was building an Uber for everything. But that original founding group fell apart quite early, and but along the way I met Dr. Mitchell Tanner, and he became my co-founder of Stigma Health because we were both just like, what's the internet great at? It's great at anonymity, which is also a bad thing, but it's a great thing. People will say anything online, which is good and bad as well. Probably more bad in most cases, but it's good example. And that we allow that people to overcome their own psychosocial barriers to getting healthcare. And socioeconomic barriers. We put healthcare on their terms. We're using the internet. So we built a form and a rough website, and people started paying. And then we had to pull it down and get it all approved and get it all aligned. But we did that test, and that's where we started. So yeah, 11 years ago now.
Yeah, wow.
Mm.
So, did you notice that there was an issue with people accessing STI testing because of the simple fact that they didn't want to go in and talk to a physical, like a doctor in person? Is that what you like? Did you notice that somehow? Is there a story attached to that, or?
So look, I was like, I'd only been tested a couple of times in my life at this stage, and it was like, the whole experience was awkward. Doctor didn't ask me. I had to ask him. Yeah, it just wasn't done well, and like you think it could be done better. And then we started doing the research, and you could see, yeah, it's not done well. It really didn't take as long to put together a case study, and Dr. Mitchell Tanner, the GP, he knew very well knew that it was an issue, and there was an issue back then that doctors weren't having that conversation, weren't initiating it with young people or anyone, and young people weren't initiating it either. So then, if no one asks, no one's gonna get a test, right? So, but we put it all back on the patient's terms to activate when and where they're ready. So it went from there. Mm.
Yeah, I'm also a big fan of business as well. And I love businesses, especially like yours, that notice a gap in the system and then they fill that gap with a whole new idea. Because I have so many stories I could tell you, and I'm sure you've heard so many stories. And you probably don't know, I'm a full service sex worker in Melbourne, based in Melbourne. And the amount of conversations I have with clients that are in their 40s, 50s, or 60s that have never been tested. And
Yeah.
asking for natural services, and they've probably been partaking in natural services with sex workers. Potentially those same situations, they're married as well, right? There's
Yeah.
so many problems, right? And I think part of it is typically those people, they see the same GP and they have seen the same GP their whole lives. So, there's this extra layer of embarrassment in seeking that. But yeah, I'd love to share, and I do. I have conversations all the time sharing with people how important this is. So, for somebody who has never had a STI test, can you explain how they could access your service, Stigma Health? And yeah, just explain that simplified experience for those that have never done this before.
Yeah, so we actually run three online sexual health services now, Stigma Health Out being our main one, and then we have Hey Fella, more targeted towards the gay male community, and then we have Prep Health, which just sits in the HIV prevention, but not as targeted. We're trying to cover all bases for and meet patients where they are on their terms. And but the service began with like a real simple form base because it was only Dr. Mitchell Tanner and I. We didn't have time to answer phones or do more. So it's just pure sexual health questionnaire referring directly to the guidelines and yes, no questions. Are you a sex worker or have you ever been a sex worker? Do you participate in MSM sex? And do you like intravenous drug user, indigenous, like these all determine tests you need, and then we would spit out the referral. It was all manual, but it's because it's all based on the guidelines now, it's all an instant referral. And that's form based. That's unfortunately or it's user pays, so it's not that's just how it is. Medicare refuses to cover that because we don't have a medical intervention between the form being submitted and the testing. Medicare do cover the testing still though, which has been tested and validated. So that's why we charge for that one. But then we have a fully bulk billed telehealth service. So people can make a telephone appointment and speak to one of our doctors. We've got appointments available 6 to 7 days a week. And that's fully bulk billed and but it does rely on appointment times and just the standard inconveniences, but obviously you don't have to go into anywhere to get it done. And but both result in an outcome of a instant pathology or a pathology referral, and then you can go to any clinic in Australia and get tested. And we should have your results in 2 to 3 business days. We don't know when you've been tested though, so if you haven't heard from us within 2 days of being tested, we encourage you to let us know. So
Yeah. Yeah. Yeah, I've used your service before. It's so simple and easy. And, it's also tricky to find a GP that they don't always have to specialize in sexual health. But sometimes I've had some experiences where they really don't know a lot. And I've even had experiences of being like a supportive person to others where they've been given a kind of diagnosis from a doctor without a test,
yeah,
which
well,
blows my mind. Like, what's happening in our medical service? So yeah, and everybody just has such a smooth experience with Stigma Health within, you know, doing the testing, getting the slip, going to their like pathologist and getting it done and getting their results. And I've even spoken to workers that, certain things have come up, there's a question, and then they've gotten in contact and they've gotten their questions asked. Like, it just seems like, Stigma Health is just seamless in what it offers. But I can imagine that there was maybe some challenges in starting up, especially because you're not in the medical, like you don't have that medical education. So, what were some of those challenges in the startup phases?
well, in being non-medical is yeah, it is a blessing and a curse. But blessing because you just think about things from your perspective, which is like no experience, naive, and I probably wouldn't have started this if I was in healthcare because I would have realized how hard sexual health is. But being that naive and young and just seeing the need and the problem and stubborn, we went at it. So and you just think about it from first principles. So you just like, does it have to be this way? Does it have to be that way? Like, is it right? Like, you just challenge everything and probably annoy the doctors I work with sometimes because I'm challenging everything all the time. I challenge less now because I do kind of understand where they're coming from. And sometimes I'm giving them context because I've seen a lot. I think I may have lost track of this question now, Eden. Sorry.
That's
Recovering.
okay. I guess, yeah, was there any sort of challenges to overcome
Oh,
within the startup? Because, like I said, you guys are seamless now. There's no issues now, but yeah, I'm sure that there may have been sort of in the beginning stages. So what was the biggest thing to
yeah.
overcome, or was it just more that medical, the collaboration between the medical side of things?
Well, fine. I found my medical partner straight away, so we did overcome that. The like initials were like it just took Medicare a long time to approve our business model. Actually, for a while we ended up operating because they didn't approve it, but they didn't like say you couldn't do it. So we were like, well, that's good enough, and we kept going. And we're now probably too big to fail. We're Australia's largest sexual health service, but we're also not doing anything wrong. Biggest issues really like besides being non-technical founders. So I'm glad you feel it's seamless. We've got so much improvements on our roadmap that's going to be just so much better in the next 12 to 24 months as we just roll out changes. So it's going to get better, but being non-technical is a big issue. And we just did the form very simple. We didn't start with our instant referral either. The patient would submit a form and I used to go enter the details, and then the doctor, Mitchell Tanner, would go and process the referral in his time, and that created a lag. People with the internet expect instant gratification. They want something instant. And, we were just two people running two other businesses and we weren't working at full time. So that was the other issues. And then we just ran out of money as well. We just we ran out of budget. And then probably the biggest thing is just promotion because as the industry experiences, we experience the same thing. Meta and Instagram, we've been shadow banned and we've been ads, for no reason they don't get traction or we get warnings and you get those messages. And yeah, we've not done anything wrong, but we just get cast. And no one in the industry is doing anything wrong, really. I mean, not saying everyone in the industry is not doing anything wrong. And same in healthcare, people out there doing things wrong, but it's just, yeah, the promotion's been really hard. Like it's a taboo subject, and these big tech are really prudish. So, which is funny with how much smut we see on there, like, right? How much just crap, and
It's
the trolls go on, but they won't let health promotion or sex work or industry be promoted as well. Mm.
it's crazy, and I can't wait till the day where especially the adult industry isn't experiencing so many issues. It's very frustrating. But in saying that, why do you think that there is such a stigma around sexual health?
The stigma. Yeah, I don't understand. Like sex is fundamental to all of us. It's for connection, for relationships, for pleasure, for, yeah, it's part of what we do to procreate, to breed, to like the reason we're all here. So it just doesn't make sense how stigmatized it is still, but it's definitely changing. I think we've still got a long way to go, but I think in 20 years' time, we will be looking back at how stigmatized it was because society is becoming more sex positive. But it's a long gradient, right? A long curve to get up to where we want it to be or where it needs to be. To
Mm,
be
yeah, I agree. I often say that sex is like eating and sleeping. Like I honestly believe that.
yeah,
Yeah, we're all healthier when we're having sex.
yeah,
And it's also much more enjoyable if we know where everyone's at health-wise.
yeah,
So, which is yeah, it's funny because I don't think I would say even there's plenty of sex workers that will go about their business avoiding the conversation. And yet I very much like to ask everybody if they're asking me for, certain services, then I say, well, have you got test results you can show me? And then when the conversation becomes, oh no, I'm healthy, I'm clean, but they've never been tested.
yeah. It's not healthy.
Yeah, and that's the thing, like, the trying to educate people around the fact that there could be something and you could be completely, like, unaware of it, this asymptomatic experience, which I personally have had. I've always been super, super, like, efficient with my testing, and I would like to hear your thoughts on this as well because there's an idea, or most people speak around if you have an incident where you have, say, unprotected sex or something happens and, condoms break or whatever. They say to wait 2 weeks to get tested.
Yes, so there's window periods,
Mm.
be up to 12 weeks, right? It's not saying wait up to 12 weeks, but the HIV and syphilis can not show an infection for up to 3 months after contracting, right? So
Yeah.
but you still want to cover the early period, especially if you're having sex with multiple partners. And it depends. Like, yeah, it's 2 weeks before you're not gonna have sex on Saturday night and have the infection on Monday. I mean, I shouldn't say never. Like
I've
there's
kind of had that
there's
experience.
very rare-
I'm sorry to say it.
it could
Um,
happen. Sorry, I
yeah, but
withdraw
like
that. Withdraw that comment. But like there is you do have to allow time for an infection. It's like you can meet someone with a cold and you don't necessarily have the cold the next day or the flu next day. You've got it a week later.
yeah. Yeah.
Well, gastro takes 2 weeks to work through our family from daycare. So yeah.
Right. Yeah. Well, yeah, like I said, I can be a little bit too efficient, but I like to get tested monthly. I know that they say for sex workers it's every 3 months. And I just feel better about like monthly testing, and I think that yeah, I
Yeah.
like to encourage that.
It's
But I
interesting.
have
Yeah,
yeah.
the guidelines like basically put everyone high risk into one group of every 3 months. And look, a lot of that, those guidelines aren't necessarily about best healthcare, they're actually about saving Medicare money. But the
Yeah.
guidelines also say to get tested every time you need, basically, every time you feel you've been at risk. And they also call now for people, doctors, not to, if you ask for an STI test, they're not to say, why do you need an STI test? Because like people don't answer that question truthfully, or they don't need to answer that. If you ask them for
Mm,
an STI, no one's getting an STI test for fun. So if you ask for an STI test, you can get one. And that's where even every 3 months, there's no real excessive amount of testing because if someone wants to get tested every 2 weeks, look, you know what risk you've been at. Like we don't.
yeah.
Guidelines don't. So they do cover the majority of the population really well, but then there are outliers. So, but like I didn't get tested frequently enough. I had two positive diagnoses before my first marriage. Not that the marriage had anything to do with that, just mean in the decade before that. And both of those ones are asymptomatic, and you don't know because I wasn't getting tested regularly. How long did I have that infection for? You don't know. And unfortunately, men are often more asymptomatic than women with especially like chlamydia, and that's where it keeps spreading. So
Yeah.
mm,
Yeah, definitely. Yeah, no, I've also had 2 positive tests. One was when I was younger,
mm,
and it was kind of a situation of like the unprotected sex happened, and then within a couple of days I'd gotten tested, and then within a couple of days I'd gotten the results, and I didn't have any symptoms. And then the second time was within the industry, and I used to work with another worker, and we'd offer doubles and different things like that. But then came back positive with gonorrhea, and then I got tested and came back positive as well. So, and again, I had no symptoms, so it makes you a little bit paranoid.
yeah, it does, and that's yeah. People, I think that's part of the stigma too. People still think they're going to get symptoms for some reason. I think, but we're just not taught well from a young age that there are no symptoms. Just get tested, just compulsory testing. I think there's like lots of things we could do
Yeah.
with the situation. Yeah.
Yeah. Well, on this same subject of like misconceptions around sexual health, what comes to mind for you? What's a typical misconception that you hear within conversations around good sexual health?
Yeah, just a lot of people are just like, I don't need that. And it's like, again, if sex is like eating or breathing, you do need it. You do need to be tested. And like the idea you have sex once, you can't have had something, but people are just like not ever honest about this stuff, right? I think it was famous in probably some inappropriate movie. Was it The Rule of Threes? I think it was American Pie. How women always understate how many partners they've had by three, a multiple of three, and men overstate by a multiple of three. Basically, everyone's lying out there. And it's like, so you just got to get tested. And if you sleep with one person, you could have slept with 50 people through them who they've slept with. Like, you just don't know. So,
Mm,
idea of it being like limited to the adult industry or limited to the gay community is just really outdated. Like, majority of infections are sitting out there in undiagnosed heterosexual populations. Yeah.
yeah, yeah. I remember when I was younger and we did this activity. around how easy it can be to catch things and the interactions. And I think they started off with like one person had like an STI, and basically like everyone that they interacted with, so we're just sort of like walking around and chatting and different things like that. And then yeah, everyone that they interacted with, they sort of passed on the STI. And then at the end it sort of showed how it can spread. It was a really really interesting little exercise to bring awareness around that, because yeah, like even if you're getting the other person's whole sexual history as well.
Yeah.
So, and even I think just educating people on, you can get STIs from giving a blowjob. I actually heard a story recently. Body got the test came positive with gonorrhea anally, but they don't offer anal. They like,
Wow.
how did it get there? Probably from a tongue, right? So
Hey, yeah, you had to tell me then. I wouldn't have put that together, and I'm in the industry.
I'm sorry to do this to you.
No, that's all right. This is what we do every day at work, right? This is yeah, it's good. It's good fun.
Yeah,
We like the guidelines outdated. They don't actually offer anal swabs for women. They don't offer throat swabs as a standard for women. We offer those options because we started picking up anal diagnoses and non-vaginal diagnoses from, and who knows how many people out there we missed because we've stuck to the guidelines for asymptomatic patients. So um,
yeah.
yeah, if we got challenged on that, we've got the evidence there that we've got the diagnosis rates, but yeah, we had to get to a scale where we could challenge those guidelines. And
That's
anal,
amazing.
it's losing its taboo massively. Like it's just becoming so normal. Yeah, like nothing's taboo anymore, really.
Yeah. No, it's honestly, it honestly really, really amazes me. And when I first started in the industry, nobody ever told me about sort of throat swabs. And normal people, like we call them, civilian people that are just not getting paid to have sex, they're not getting throat swabs. GPs are not getting throat swabs. Like, yeah, it blows my mind. I'm like, we need to spread the word.
Yeah, it's obscene actually, because then like we're never gonna. If we just did throat swabs, we'd probably kill half the infections. How much would the extra cost be? I don't understand it.
Yeah.
Similarly, like I don't know why we don't offer free tests to every backpacker that comes to the country or little
Mm.
things like that. But yeah, not testing throat swabs for the majority of the population. Like, is everyone really not getting BJs? I don't think so.
Yeah. Have you guys noticed an up like a what do you call it? Sort of an uprise in positive results? Have you noticed that?
We do see trends time to time. Syphilis definitely on the rise. We can see when there is STIs are rising. The latest data will be interesting, and we sort of work with the researchers as well to see what they're getting from the system. But yeah, syphilis is definitely one we're on the aware that it's on the rise, which is it's scary.
Yeah,
It's something that think a lot of people thought was last century or yeah, yeah.
that's right. And even with syphilis, like that can just start off with a kind of sore or a rash. It
Yeah.
doesn't even, it can be you, you could miss that symptom, I think.
Yeah, I think a lot of them, the symptoms aren't unique, right? They're not like they're quite, you could think of, so diagnosing without a test is obscene because they could be any of them. And I'm not a healthcare professional though, remember, I'm an accountant, so if, whatever I get wrong today, no one can hold me accountable for.
Yeah, that's fair enough. You learned any lessons since, building this company? Is there anything that you've taken from building the company that you've brought into your own life apart from getting tested regularly?
I've just learned a lot about people. Like I've got to meet like people from all walks of life. I came from probably quite vanilla Catholic schoolboy, rugby player, nerd. I was a nerd who probably hung out with jocks, sort of thing. Like straight, yeah, wasn't having anywhere near as much sex as I wanted to have. Yeah, okay, and then now I'm around sex workers and adult industry, and I got best friends in the gay community, and I'm really proud of the workforce we've got who are very, like, we cover nearly all bases in diversity, which is just unreal because we just sort of know our customers better in that way. yeah, in terms of yeah, lessons is probably just I've just what I've learned, what the world, maybe a bit more about the world from,
Mm.
and how beautiful everyone can be. Yeah.
Yeah, I love that. I am curious with somebody with that sort of background, how, because Stigma Health is often a sponsor in a lot of adult industry events, how did that relationship develop? Whose idea was that?
Yeah, so we did think the adult industry well, look, we not the adult industry as such, but sex workers we did think was a market early on. But we do screen, everyone gets that question up front in the risk profiling for the testing they get. And so, and then I was on the phones until I think end of 22 or in 23. We finally got someone else to answer the phones, but I had, the first 30,000 customers all had my phone number. So, and then inevitably, when you're speaking to your more frequent customers, you end up forming relationships, strictly professional, but like just, yeah, you end up getting to know the people behind that call, behind that form. So that's how I began to realize. And then also those high frequent customers in the industry, sex workers, they became really good, invaluable people for giving me feedback and information. So I was like reaching out to them for that. To, how can we improve? What can we do? And how can we get more from the industry involved? Because look, it's good business and it's good for the community to look after the sex workers. Then the events, they just came up, right? We were approached for one awards, I think, and then once you sponsor one, you start to get more and more just knocking on your door. And we're trying to spread the love around everyone. And yeah, we are trying to just sponsor and look after everyone. It gets hard because we are still a small company. We still don't have a huge amount of resources. I think people, because we are getting more known, especially in the community, that people think we're bigger than we are. But I'm still working from a home office today. We do have an office in Newcastle now, but it's only a 3 desk office, and the whole team's remote, and it's still a family business basically. So yeah, look, I guess I fell into supporting the community, and it's just fun to be a part of, to sponsor and support and do what we can and listen to concerns and see how we can help. Mm.
Yeah. How fun is the adult industry? Are you loving it? Coming along to these events and all the wild things that happen, do you love it?
Yeah, you hard. I don't want to sound sleazy. You try always checking yourself. Be like, teenage James would be very happy with his life right now, right? Like,
I love it. I'm like addicted to it. I swear it's like the most realist in like it's like the real world. I feel like the outside world isn't actually real. And then this is the real world because the conversations that people have, they're very open. And I also like to think that the STIs kind of stop with sex workers because we're so good at getting tested and we're not, very unlikely to be spreading things around and, all of those things. So that's what I like to think. We're doing our part at putting a stop to things.
definitely doing your part. Definitely doing,
Yeah.
and the education piece. Like we've never. It's definitely come back to us, after we started supporting the community, or even just before that. We found advocacy from, not many people are going to share that they've had a test, but the sex workers and the adult industry will share and they'll tag us, and it helps because they're having sex with the public. They got a name out there, they got followers, and it's just not easy for us, and it's really appreciated. Yeah.
Yeah. I'd love to talk a bit more about prep. I honestly don't know much about it. I had somebody else on the podcast that sort of made this statement that they believe that every sex worker should be taking prep. Could you educate us all on these preventative medications that are available now?
As the accountant come sexual health clinic founder, I can, but full disclaimer, I'm not a healthcare professional, to remind everyone listening, because I'm probably going to enrage some people. But like, yeah, I actually do think every sex worker could be on PrEP. It comes down to, so it's a medication that's over 99.9% effective against contracting HIV. So it's a miracle drug. We were prescribing it, everyone's taking it daily, but now you can take it on demand. But that doesn't apply to women. So that applies to the gay community and men, because it's trying to think of the right word. Basically, the efficacy in protecting you from HIV and vaginal intercourse is not as good as anal intercourse. So it takes women have to take it for 30 days and have to take it daily. I don't believe this has changed. There are injectable PrEP and stuff though too now, which I'm not sure about the efficacy of them for women too, but they're only new on the scene. And women can take it. You've just got to take it daily, right? And it's on
Yeah.
the PBS. It's not a dear medication, and considering the risk it covers, it's pretty bloody good. Yeah. So
Yeah.
that's what it is. It's a contraceptive pill for HIV. That's my best way to explain it. It's like it's going to stop that.
Mm.
Mm.
Yeah, it's yeah, I'll have to keep and if there's any sort of resources that you could send me that I can link in with the show notes, yeah, it's the world is crazy. It's amazing. And having, friends within the community that have had experiences of getting positive results with HIV. I also know people within the community that have gotten positive results for Hep C, and I know that there is also medical things that you can do if you do contract those diseases. Yeah, it's an amazing place. People that are, doctors and people in the medical field that have worked on overcoming these very scary things are just it's amazing. It blows my mind.
And on that, 2026 is very different to 1985, right? So HIV, to live with HIV now is less of an impact on your life than living with diabetes. So, but it's still got twice the stigma or 10 times the stigma. But yeah, you can live a perfectly normal, long, healthy life and not be viral, still have unprotected sex. You would encourage anyone with a partner with HIV to be on PrEP though as well.
Mm.
And but if they're non-viral, like there's another word for it. If I was a doctor, I would know, and I should know it. And anyway, there, if you basically you can't spread the infection. So yeah, it's perfectly manageable disease now. Doesn't mean we all want to go get it or manage it. We can manage to avoid it with PrEP as well. So and other safe precautions.
Yeah. I feel like the other big one that has one of the most amount of stigma is people living with herpes. Yeah, and that's I think technically medically they say that that's incurable as well, but maybe not.
Well,
There's
I
some
think one in two of us have herpes or like cold sores, and then I think one in six of us have genital herpes, right? And so it's like it's just and it's underreported that people don't get a lot of people live asymptomatically or they only get a few symptoms when they're run down and stressed. Others need to take the daily and there's a medication for it,
yeah.
Valor, yeah, it is. Herpes is well over stigmatized. It's well like it's yeah, it's just rubbish. How people are beaten up for it, or it's like thrown in people's faces, and by you can see trolls do it. Oh, you'll have herpes, or you'll have like it just comes up all the time, and you're just like, it's perfectly like it's not going to kill you. It's not
Mm.
like cause you issues. It's perfectly manageable. Still got to be honest with your partner if you've got it or know you've got it, but yeah, it's well over stigmatized.
It is, isn't it? Yeah. Well, I do hope that conversations like this and conversations that I want to continue having on the podcast is going to help, just educate people and have people not so judgmental on these situations too. I guess the other thing is, and I don't know how you felt when you had those experiences of getting that positive result, but even that, maybe we could work on help people realize that it's not the end of the world to get a positive test for chlamydia or gonorrhea. That needle's nasty, but you get it and it's done with.
I managed to avoid the needles. Yeah, I had just the azithromycin, chlamydia twice in my younger days, and I've tested a lot more. Funnily enough, since I've been married, because I've been testing just for the service, and it's yeah. I remember the first time. The first time I had a letter from a doctor's for the testing. I remember my mum. This is before I even got the result. My mum opened the letter, so it was a horrific start.
Oh.
I lived at home, so she's just opened my mail. She won't be listening out there, but she's overprotective, over no boundaries mother. I've moved home 6 times, so she doesn't change every time I go home. She still has no boundaries. Anyway, there. They went on to a positive result. I had to tell a few partners at the time because I didn't know how long I'd had it for, and that was quite hard. The next time, I think a partner told me she had it, and I remember being really incensed because the way she told me was like she got it off me. And looking back, I didn't turn around and blame her, but I was like, blame. I got really upset about being blamed, and I was like, you didn't need, and when you tell someone the news, maybe you are certain that you got it off one person, but of course it can be asymptomatic for a long time. You really have no idea.
Mm,
That doesn't even matter who got who or where it came from. So don't get hung up on it. Don't stress about it. Don't blame. Just go get it fixed. And you
yeah.
tell your partners. Yeah, it's not a big deal. It's not like, yeah, no one's being slut shamed for having it. No one's like, don't, yeah, just go get tested. Yeah, that's
Mm,
the big thing. I'm not proud of how I handled it the second time I was told. But it was more very much defensive. Like, how do you know I
mm.
gave it to you? How do you like you gave it to me? Like, it does like, how do we know? Like, and it does not even matter. So,
I remember having a very similar conversation in that experience that I got that positive result as well. And even I remember other situations where, a friend of mine was in a long-term relationship, and unfortunately he was cheating on her the whole time, and she didn't get tested until the relationship had ended. And I think that's the biggest thing. There's more issues with contracting things and not having it treated. People aren't aware that you can have fertility issues from having chlamydia in your system for, longer than you should be.
yeah,
So, yeah, that's why we should all be getting tested.
yeah,
Yeah.
100%. And like, I think, well, women are tested now during pregnancy as well. They're not getting tested enough throughout their life. And I believe chlamydia is still the number one cause of infant blindness around the world. So it may not be as much of a problem here, but these are the consequences of unprotected sex. So, yeah, I think we all have to get tested here because we can afford it and the country allows for it. And that's our bit for the world too, because we take STIs around. Everyone takes who travels takes STIs with them, unfortunately. Yeah, just got to keep working on it.
Yeah, I did not know that actually. And I knew that if you contract an STI while you're pregnant, the medication that they kind of want to avoid giving you medication for
Have to
like
treat,
while you're pregnant. Yeah.
yeah, yeah,
Yeah.
treat it differently. Yeah, so it has to be looked out for.
Definitely. Well, I do hope that I bring a whole new range of customers your way. A big portion of my listeners are consumers of the industry, so men that like to partake. So, and they need to get tested, guys. You need to get tested, please.
Definitely. Yeah.
Well, thank you so much, James, for this conversation. I've been looking forward to it all week, and you did not disappoint.
Thanks, Eden. I've really enjoyed it too. So anytime. And
Thanks.
you should get Dr. Lee Barlow back. He would be a great follow-up act, I think. And he could straighten out all the things I might have got wrong today.
Yeah, I would love that. I've watched every season of Grey's Anatomy, so I feel like I'm practically a doctor now, and I would definitely specialize in, sexual health side of things. So
I,
I
I,
would love.
I learned all my medicine from Grays, but probably more from House. So yeah.
Yeah, yeah, House is a good one too. Well, thank you so much.
Yeah. Thank you, Eden. All right, let you go.